Hey, how's it going? My name is Dr. Malsberg. I'm a psychiatrist and multimedia editor-in-chief at Carlat, and I make videos under the name Psychopharm. This video is on Vilazodone. The brand name is Viibryd, which recently went generic, but is it worth prescribing? So let's get started. Vilazodone lost its patent in June of 2022. The price of this multimodal antidepressant has fallen to below $40 a month. More patients can afford to take it, but whether we should prescribe it is less clear. If you want to follow along, I recommend checking out our fact sheet on Vilazodone. To get free access, just go to thecarlatreport.com/Vilazodone and we'll email you a free helpful fact sheet. To get started, let's talk about its multimodal action. So Vilazodone wraps the effects of the popular SSRI buspirone combo into one drug. Like an SSRI, it's a potent serotonin reuptake inhibitor, and like buspirone, it's a 5-HT1 serotonin agonist. Vilazodone's manufacturer hoped that this dual mechanism would lead to a faster onset, more anxiolytic effects, and fewer sexual side effects. At first, those hopes seemed to pan out, but today they really only hold up if the data is cherry-picked. So let's start with the faster onset of action. So Vilazodone's clinical efficacy rests on 4 large short-term randomized control trials in major depression. In the first trial, it separated from placebo at 1 week, and in another, it separated at 2 weeks. However, there was no early response in the remaining 2 trials, and most antidepressants have some evidence of early efficacy within the first 2 weeks. Its antidepressant effects were similar to those of citalopram 40 mg per day in a large head-to-head trial of over 1,000 patients. The study also compared 2 fixed doses of Vilazodone, 20 and 40 mg, and found no evidence of greater benefits at the higher dose. Overall, Vilazodone's efficacy is similar to that of other modern-day antidepressants, which is not particularly high. The number of patients needed to treat to achieve a response that wouldn't have been seen with placebo is 8, compared to about 4 to 16 for other antidepressants. Whether Vilazodone can reliably bring patients to full remission is debatable. A meta-analysis suggests that 10% of patients achieve remission, but the only large trial that reported remission rates was found to be no better than placebo. And Vilazodone has never been tested in treatment-resistant depression, but 2 switch studies in patients who failed to recover after a trial of an SSRI or SNRI cast doubt about its ability to work when other antidepressants haven't. Its long-term data are also uninspiring. Vilazodone failed to prevent depression in a large study that randomized patients who responded to the drug to either placebo or continuation. This is pretty telling since these enriched study designs usually favor the antidepressant. So is this medication actually better for anxiety? With its resemblance to SSRIs and buspirone, Vilazodone might seem like it's better suited for anxiety disorders. However, its lack of FDA approval in anxiety disorders, despite industry-supported trials in generalized and social anxiety disorder, raises doubts. Vilazodone did work in 3 randomized control trials of generalized anxiety disorder at 20 to 40 mg per day, but the effect size was small and its tolerability was poor in this population, particularly with nausea and diarrhea. An industry-sponsored social anxiety trial was positive, but the study was small and the dropout rate was high. A larger follow-up study in social anxiety disorder was abandoned midstream. The story does brighten when we turn to anxious depression, but not enough to endorse Vilazodone as a first-line option. So data was reanalyzed in 2 large Vilazodone trials to see if its effects differed with anxious versus non-anxious depression. Vilazodone improved both anxiety and depression in the anxious group, but did not work at all in those with non-anxious depression. That almost sounds like an endorsement of Vilazodone in anxious depression, except for this. A large trial found that citalopram was a more effective anxiolytic in depressed patients than Vilazodone. Is it actually better for sexual side effects? So when the medication was first launched, the initial data suggested the drug lacked sexual side effects. Later we learned that most of the patients in those trials had nothing to lose, as their sex drive was already close to 0 when they started the medication. So while Vilazodone did not lower their already low libido, it did cause sexual dysfunction in those who entered the study with their sex drives intact, at a rate of 8% versus 1% on placebo. Later head-to-head comparisons with sertraline and paroxetine suggested that Vilazodone carries a lower risk of sexual dysfunction than the SSRIs, consistent with the partially supported idea that buspirone treats SSRI-induced sexual dysfunction. What about tolerability? Overall, Vilazodone's tolerability problems are similar to those with the SSRIs. with transient nausea, diarrhea, dizziness, lasting sexual dysfunction, and insomnia. And there's no reason to think that vilazodone is free of the more serious SSRI side effects, like hyponatremia, osteopenia, suicidality, and withdrawal problems. But there's not a lot of research in this area. So how do you use it? Vilazodone dosing is relatively straightforward with just a few obstacles. So for example, it needs to be taken with food. That's because up to half the dose gets unabsorbed in a fasted state. And on top of that, potent CYP3A4 inhibitors, like grapefruit juice, can raise levels about twofold. So what's the Carlat verdict? You should consider vilazodone in patients who respond to an SSRI, but need an antidepressant with a lower risk of sexual side effects, and who don't respond to bupropion or vortioxetine, where sexual side effects are closer to zero. Otherwise, there are several reasons to avoid this antidepressant first line, like tolerability, food interactions, and questionable benefits when it comes to preventing depression or treating comorbid anxiety disorders. If you found this video helpful, definitely head on over to thecarlatreport.com and consider subscribing to the Carlat Psychiatry Report, where we give you unbiased news, all things psychiatric, with useful clinical updates, expert interviews, and bottom-line assessments of the latest research studies. And subscriptions give you access to post-tests where you can earn CMEs.